Everyone is waiting for the heart attack to make its grand announcement. Then they run to the doctor. You have missed the bus. All the policymakers should start thinking about how do we produce more nurses, because there is a global shortage of nurses and India alone is short of 2 million nurses. I see all the scientists, all the the smart people, they have total knowledge about the surface of the moon, but if you ask them how is your liver, they don't know.
The sudden heart attacks which are happening, and of young people just dropping in the gym or at workplace.
Most people do not know that how fit they feel has nothing to do with how fit they are, and that leads to silent heart attack.
Many people say that it could be because of the pandemic, because of the vaccines.
People did develop heart attack before the vaccine also.
Yeah.
So you can't just put it across vaccine.
One part of your life I want to ask you about was Mother Teresa.
I was in B.M. Birla at that time and we treated her. I believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy.
Namaste, Jai Hind. You're watching or listening to another edition of the ANI podcast with Smita Prakash. This episode is being filmed in Bengaluru, Karnataka at the Narayana Hrudayalaya Hospital. My guest today is the renowned cardiac surgeon, Dr. Devi Shetty. He's in fact known as the bypass wale Baba in India. And the reason is because of the thousands of surgeries he has performed in rural India, especially in children. Dr. Devi Shetty, I can't tell you how thrilled I am to have you on the podcast. It's an absolute honor to be speaking to you.
Thanks, Smita. Thank you. I'm equally excited to talk to you.
This show is going to be released after about a month, which is after all the election-related madness is over in our country. So hopefully everybody's heart will be at a much lower pace than it is with all the anxiety which is going on in the country, because there's so much at stake, when the country goes through this phase of elections. The stress levels are very high among everybody, whether it is politicians, whether it is us journalists, whether it is the election commission people. So I'm hoping that when we have this discussion, when this discussion is aired, everybody's in a calmer state of mind. Everybody's concerned about the sudden heart attacks which are happening, and of young people, young professionals who are seem physically fit, I'm not saying are, but who seem physically fit, who are just dropping in the gym or at workplace. What is it that is happening? Is it something extraordinary, or were we hurtling toward this anyway?
Most people do not know that how fit they feel has nothing to do with how fit they are. More than 50% of the patients with the heart disease, they have no symptoms. It's called silent ischemia, and that leads to silent heart attack. Every time a celebrity or somebody famous has a sudden heart attack, media goes berserk and everyone starts debating why it happened. It is simple. If the same person had few cardiac tests, like a CT angio, 10 years earlier, that heart attack, so-called sudden heart attack, could have been anticipated or prevented. So there is nothing like a sudden cardiac arrest. There is nothing like a sudden cardiac arrest. If people bother to consult the doctors, get the right tests done, all these deaths can be stopped. It is needless. It's only because of the feeling that you see the doctor when you have pain or when you have a problem. That is the fundamental flaw in the modern healthcare. I can understand 20, 30 years ago, we didn't have sophisticated gadgets to predict these events. Today we have some of the most advanced medical equipments which can predict anything, which can give you the accurate information without even using a needle. And this is the beauty of healthcare. But people do not want to see the doctors when they have no pain. Everyone is waiting for the heart attack to make its grand announcement that I am hitting you. Everyone is waiting for cancer to make its announcement. Then they run to the doctor. You have missed the bus. I'll give you an example in Bangalore. City like Bangalore has at least few thousand young men leading a perfectly normal life, very active. If they run a marathon, they will drop down dead because they have very severe coronary artery disease. They have no pain. There are few thousand young ladies with early stage breast cancer. They have no pain. They will never see the doctor. But by the time they develop pain, it's too late. Modern healthcare has given amazing tools. It is the failure of the people to seek the medical help. Doctors like us, we don't want to go for the preventive checkup. Right? Okay, our friends and relatives and everyone, we can tell them. Otherwise, they'll look at us as, okay, he's trying to solicit for his business.
You're absolutely right, doctor. There's that inbuilt fear also that if I land up in a hospital just for a preventive checkup, there will be an interventionist thing that the doctor will do. So there's that fear factor. One is, of course, the money. That itself is a major hurdle, as you know. And the second one is about this, that it will lead to something. So there are a whole host of issues that go into it, doctor.
You see, I understand your concern about why people do not want to go for a preventive checkup. It is essentially failure of the medical system than the failure of civil society. Because people do not want to go to hospital. I have been practicing medicine for the last 40 years. I have never come across a single patient who will say that I love to go to the hospital.
True.
Okay? Hospital is not the best place for people to visit. So we are doing a pilot in Prestige Tech Park in Outer Ring Road. In Bangalore. There are 3 reasons why people do not want to go for a preventive checkup. First thing, they hate hospitals. Yeah. I understand. So we are going to tell them, okay, there are 60,000, 65,000 people working there in the tech park. We are setting up a full-fledged preventive checkup facility with all the blood tests, echo, ultrasound, mammogram, the CT scan. Everything like a hospital, we are going to arrange it there. So we are going to tell them, okay, you guys don't want to come to the hospital, fine, we'll come to you. Okay. Second reason why they don't want the preventive checkup. It takes whole day from morning till evening. If you have to do all the tests, it takes whole day. We are going to promise them that we will do all the tests in 60 minutes. Okay. And if it exceeds 90 minutes, we'll refund the money. Wonderful. No fasting is required. You can come anytime you want. Then third problem they have is, it costs a lot of money. It costs 30,000 rupees for all the tests. We are going to charge them maybe 4,500 or 4,800 rupees.
Including a CT?
Everything. Whatever needs to be done, we'll do it. I know it doesn't make financial sense. Yeah. But we want to see whether healthy, so-called fit people are willing to get these tests done at a place where they work. They have to just step out of the work for just 1 hour, once a year. If we can succeed, right, if people come forward and get the test done, right, then we will see how we can make a business sense. Right now it doesn't make business sense, but we just want to see.
Amazing. Doc, there's this Lancet which says that cardiovascular diseases, henceforth I'll use the term CVD for our viewers and listeners. It's a leading cause of death and disability in India. When I was asking you about, you saying that people who run marathon, most of them already have it, the cardiac issues. The global average of deaths is 235 plus 10,000 it seems, and in India it's 272. So we have a greater CVD burden as compared to the rest of the world. Why?
See, when I used to work in England, our patients were mainly elderly retired people. in India, it is the young breadwinners of the family who need bypass. In my practice in India, it is not the young son bringing the old father for a bypass grafting. It is the old father bringing his young son for a bypass grafting. The entire profile of the patients have changed, right? So it is sad that when you are young, when you are fit and so much of responsibility on you, right at that time, you are stuck with this problem. But the best thing about heart disease is if you get the treatment before you develop the heart attack, we can almost assure you that you will have your normal lifespan, at least till your working years of 60, 70 years. These are the tools available today. We have amazing tools. But if people come at a late stage, there is nothing we can do. So essentially, people should be very cognizant of the state of their health care. Everyone should know their numbers. More than 70% of the people don't know their blood pressure.
Yep.
Right? So how long it takes, you can buy a BP apparatus for 2,000 rupees and you can get the blood pressure of the whole family. So people have to have a kind of a awareness of what problem they have. I see all the scientists, all the smart people, they have total knowledge about the surface of the moon, but if you ask them how is your liver, they don't know. Because significant percentage of young people, fit people, have a fatty liver.
Yes.
And if they don't do something, just change the diet, lose some weight, you can reverse it. If you don't, in 10, 20 years' time, you develop cirrhosis.
Which most people think that because they are non-drinkers, non-alcoholic drinkers, so they will not have liver problems.
Exactly.
Yeah.
So everyone should know what their blood pressure is, what their heart rate is, they should know what their blood sugar is, they should know their thyroid profile is, because 13% of Indians have thyroid problems.
Does that result in a heart issue?
No, it results in multiple problems.
Because of
your
the
cholesterol goes up and so many other things. And one blood test once a year, you get all these reports.
But why Indians, doctor? Why is it that we are more susceptible to heart ailments as compared to the rest of the world?
See, nobody knows, but we have a much higher incidence of diabetes. Okay. Diabetes, most of the time, leads to coronary artery disease.
Yeah.
That is one risk factor. And also, we generally lead a very sedentary life, and our food habit has completely changed. I remember as a kid, I used to eat only fish and rice and vegetables. Today, you look at the quantum of varieties of sweets what is available, all the junk food what is available.
Yeah.
We are paying a heavy price. Yeah.
Doctor, in another data which I have is which has got reported in a number of newspapers, and when I discuss this, there are people, for our viewers and listeners, the data is from the National Crime Records Bureau. Now, when I cite this, there are many people who laugh and who say that why this? Because in India, the unexplained deaths come under this, or the sudden deaths. So according to this, 12.5% increase in heart attacks in India in 2022. And that's almost 32,500 deaths related to CVD. We don't have the 2023 data as per this. Many people say that, or are conjecturing that it could be because of the pandemic, because of the vaccines, because of the complications as a result of the pandemic.
Anybody developing heart attack, my wife says it's because of the vaccine. So I try to explain to her, people did develop heart attack before the vaccine also.
Yeah.
So you can't just put it across vaccine. You see, today we get to know a lot more people, their life, what is happening in their life, compared to 20, 30 years ago, because of all the social media and technology tools. Like I know so much about my classmates, which I never knew in the past, right? So essentially, we get to hear, and also there is no doubt the incidence of heart attack is definitely a lot more prominent. Whether it's increased or decreased, I don't know, but it is happening, it's common. Yeah, it is common.
Doctor, because I'm based in Delhi, the result of pollution on heart-related issues has become another thing which is very common, which people don't want to face because they say pollution will cause lung problems. Why would it result in heart issues? But it is doing that, and especially it's affecting children. So could you shed a little light on this?
Pollution has a massive impact on the human body. I don't know the extent, but I just want to give you one example. My son is a heart surgeon. He went to Japan for his fellowship in aortic and thoraco-abdominal aorta surgery.
Okay.
So first thing he did was, when he looked at the first patient, 80-year-old man with the chest open, with his lung, he was describing, he called me with the excitement, he said, "Dad, this 80-year-old man's lung looks exactly like how a baby's lung is." Whereas in India, when you open the chest and look at the lung, it is studded with all the, most of the time it is a tobacco or other particles. It's all studded with black spots everywhere. No, in adults. Adults, it is studded. Babies in India, it looks pink. But when they are 30, 40, when you open the chest, the lung looks awful. Whereas in Japan, it looks like a baby's lung. Yeah.
It's that clear.
That's clear. It's a pollution.
But the tobacco is not necessarily because they're consuming it or they're smokers, it's second-hand too?
See, it may not be entirely due to tobacco. It may be the pollution in the air.
Yeah, it's kind of bizarre because all of us in Delhi have patchy lungs because of poor air quality, and children get holidays because of that, and they said it's resulting in mental ailments, and the worst thing is that if it is cardiac related, it's non-reversible in many issues. Like in many cases, you're stuck with it for lifelong medication and things like that. How does one make families aware, the social pressure that should be put on our policy planners? What do you suggest?
See, the one good thing is there is a lot of awareness by the policymakers about the pollution, not only in Delhi, across the country. And it's a matter of time before, right now, scientifically, there is no affordable solution. But it's a matter of time, it will come up and things will be sorted out. Because the greatest problem is creating the awareness. Yes. Now the awareness is there. Now we have to come up with a scientific solution to address it. Yeah. It is a matter of time before these things will be addressed. Because this is a man-made problem. If it is a man-made problem, we can address it.
And you really do a lot in spreading awareness. I remember speaking to you during the COVID time when you were available to us, even though you had so many responsibilities. I spoke with you and I spoke with doctors from AIIMS. It was an incentive that Doordarshan was doing, where they wanted to, incentivize people to stay at home and take care of their health and well-being. And you came on air, so I'm very grateful to you for speaking at that time. But I want to come to the thing about treatments that people come to. The fear of treatment is about the money involved. We spoke about it earlier. Now, I spoke with Dr. Manjunath yesterday. Of course, I spoke to him because of politics, but since I had him captive, yes. I spoke about health issues. Sure. He said that 70% of treatment in India is carried out by private hospitals, and if India needs affordable healthcare, the private sector needs to play a significant role in it. So, could you tell me what can be done that private healthcare becomes affordable to everybody, and what can policymakers do to do this?
I am happy you asked me the question, Smita. I believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. Now, you may think, okay, it will happen, but it will take 50 years, 100 years to happen. No, it will happen within 5 to 10 years' time. Okay. Yes. Because we have all the pieces of jigsaw puzzle within us. Our missing link is people do not have the money to pay for the healthcare.
Yes.
Now, our government has reformed Insurance Regulatory Authority, IRDA, and they are now very, very progressive in terms of proactively asking people like us to become health insurance companies. So it's first time a hospital has become a health insurance company. They granted the license to us.
How does that happen?
Yeah, I went there for a meeting, and I was asking them, about the health insurance. First thing they said was, if you are interested to become a health insurance company, we'll help you.
So what do I do? I come and start depositing money in your insurance?
Once I have the insurance license, there are a lot of formalities. Normally it used to take about 2 years. We got it in less than 4.5 months. And next month we'll be launching the health insurance.
Okay.
Now, you're aware of the health insurance.
No, I don't know how a hospital is health insurance.
You know how the health insurance works?
Yes.
Yeah. There are health insurance companies. You pay the subscription, and if you go for the treatment, they are supposed to pay you. But unfortunately in India, health insurance is not yet getting delivered the way it should be, primarily because 3 reasons. There are 3 important stakeholders in healthcare. First is the health insurance company, second one is the hospital, and third one is the patient. Health insurance company doesn't trust the hospitals. Hospitals do not trust the health insurance company. And the patient doesn't trust both parties. And those 2 parties don't trust the patient. We have 3 stakeholders. Each one is trying to take advantage of the other.
Trust deficit all through.
Yeah. So in any business, if there are 3 stakeholders and they don't trust each other, that business cannot be scaled up. Now, when the hospital becomes a health insurance entity, the whole rules will change. Like today, nearly 18% of the heart surgery done in India is done by us, by our group.
The Narayana Hrudayalaya.
Yeah, our group across the country, we have multiple hospitals.
Okay.
We do about 16% of the heart surgery of India. And we have no incentive for preventing people from developing heart attack. More people develop heart attack, it is better for our business.
Yes.
But when I become a health insurance company, the whole equation changes. Yeah. So I will work very, very hard to make sure that people don't develop heart attack. Because if they develop heart attack, I lose money. If they don't, if they remain healthy, I will save money. So then, like today when I tell a patient, you need a bypass grafting, first thing goes to the patient's mind is it really required?
Yeah.
Whereas when I'm a health insurance company and tell the patient you need bypass, there is no conflict. Patient knows I'm going to pay for it.
Yeah.
So the whole relationship changes. Yeah. Like this, there are many things what is happening in India. Like you may not be aware, in the last 7 years, our government policies allowed to double the number of medical college seats. Double. What took us more than 70 years to create, about 60,000 medical seats. Today, we have nearly 110,000 medical seats. Similarly, the number of post-graduation seats are also double. These are amazing things. There are no countries in the world which can do what we can do.
Doc, 2 questions I have. One, I'll come to the medical seats part because it's so expensive, medical education, so I'll come to that part. But the first one, when you talked about the insurance companies and the hospitals merging together because having a common interest, when that happens, if I'm a patient, I'm just wondering, I want this, there are 3 types of stents, right? I'm just saying stent because we're doing, I'm talking to you. Yes. So there are 3 types of stents. And if I go to a hospital, they'll tell me that your insurance covers this one. It doesn't cover this one. But this is the best one that is there. Now, as I will just wonder, I said, I want the best one because I'm still young. I still have a larger lifespan. So I want the one which will give me 30 years or something. The other one is 15 years. Now, suppose somebody is 70 years old, he says, मेरे लिए तो यही चल जाएगा, I want to live 15 years, so I'll take this one. For me 15 years is enough. There are many things that go in the mind, so I will go with the insurance one, which is this. Now, if you are the doctor as well as the insurance guy, for you it doesn't matter which one. You'll probably tell me go to the cheaper one, or you'll probably tell me go for the more expensive one and you give more premium. So tell me where the conflict is then.
You see, the best insurance model in US is the Kaiser Permanente insurance. They are a very large group. They cover most of the California area. Again, it's a managed care. The best model is you give X amount of money to the caregivers and they take care of everything, and they will be working very hard whole year to make sure that you don't fall sick. This is the best model which we are trying to simulate. There are shortfalls, like with the insurance company, like you may provide less of a care compared to what it should be. But there are ombudsmen and there are methodology to prevent this kind of exploitation.
Okay.
Yeah.
But
now, why healthcare will transform, why health insurance will transform healthcare? I will give you one example. Like, I see a large number of patients. I see more than 60, 80 patients every day in my clinic. Good number of my patients are, the children with a hole in the heart. It's very sad. They come and you tell them that the child requires an operation. They have only one question: how much it is going to cost? And if I tell them that it is going to cost, say, 2 lakh rupees or 3 lakh rupees, they don't have. They cry, they beg you. It's very humiliating experience for me to have them begging me. You see, essentially, when I say it's got 2 lakh, 3 lakh rupees, I am putting a price tag on the kid's life. Yeah. You come up with 2 lakh rupees, you can save the child. You don't have 2 lakh rupees, you're going to lose the child. This is what I do. This is what everyone, all the doctors in all the developing countries do from morning till evening, putting price tag on human life. So in one side, we say that, okay, we are a developed, we are a civil society, human rights. On the other hand, you are giving officially the legal right to tell a person like me, put a price tag on the human life. But this can be addressed. I tell you how it ends. After all this drama, in the end, when she's about to leave, she will ask me, tell me, I have 1 lakh rupees. Can you help my child? This is the reason why I wanted to start a health insurance company. If I had a health insurance with a premium of 10,000 rupees per year, which will cover for all types of surgeries, right? This lady today has the premium to pay for the insurance for the next 10 years. Yeah. But I don't have the insurance. So this is exactly what we have created. We will have a health insurance with a premium of 10,000 rupees per year for the entire family. And whatever surgery is required, we will do it at no cost. There is no extra money.
But the surgery has to be done in your hospital?
Yes, because we control the price. Okay. If I have to outsource that, then there is a problem. I mean, as an insurance company, I can't say that it has to be done in my hospital. We will allow them to go to top hospitals because we don't want to risk anything. And we fix the price, how much money we will pay.
But yours is, suppose I want to, pay for insurance for my child or for my parent or whatever, then I can only do that in say a cardiac hospital. But suppose the person needs a brain-related issue, then?
We have multi-specialty hospitals across the country. So we prefer them to come to our hospital. If they come to our hospital, there is no co-payment. Okay. If they go to other hospitals, there will be co-payment because everyone has their own charges.
We were talking about Kaiser Permanente. So a question about the healthcare modules in Canada and the US, where the wait times are so long. And then you see that in India, if you can pay for it, you can get healthcare out here. The problem is in the payment. How do you see us, what kind of module should we have? Should we take the universal healthcare, the module that the European countries adopt? Should we have a blend of the American and the European countries? Or is it Asia? Is it Japan? Do we look to Korea? Which is the best healthcare model that India should adopt?
You see, it's a slogan which we have been hearing since independence, that healthcare should be free and it should be funded by state with the taxpayers' money. We studied all the countries which have successfully implemented healthcare for free with the taxpayers' money. There are three things common with those countries. All these countries are invariably small countries with a population of 500,000, 1 million, 2 million. 10, 20 million means they start having problem. No single country in the world, including United States of America, can offer healthcare to the citizens free of cost with the taxpayers' money. It has not happened anywhere, it will not happen. That is the first thing. Second most common thing with these countries, they all have a very high tax to GDP ratio of 24%, 45%. Our tax to GDP ratio is 11.2%. So government doesn't control that much of country's wealth, right? And the third thing is, these countries are already spending more than 10% to 18% of the GDP on healthcare. We are hardly spending 1.5%. So we don't have that kind of a tax collection or the tax base to have all these luxuries. But we have the power to regulate and start all these innovative health insurance programs. See, in India, there are 100 million families who can afford to pay the regular premium. If the insurance service is good, they will buy this insurance. We have another 100 million families who are directly or indirectly influenced by the first 100 million families. Some of them may be working in their company, some of them may be working in their house. They have a close relationship. So the first 100 million families can influence the second 100 million families to buy the health insurance, as long as the health insurance health insurance product is affordable and it is meaningful. And people trust that brand. And then you are left with about 50 million families who are already covered by the government. So essentially, we have a model today. See, these digital technology, all these, Aadhaar card and online payments, they have really removed all the friction in large-scale enrollment of all these health insurance programs.
Yes, the Ayushman, when you were speaking with patients, I could see that you were referring to Ayushman quite a lot.
There are many, many things what is happening.
State level.
In the end, there will be a model for everyone. Yes.
Right. You're very optimistic about that. Doc, I also want to ask you about staffing issues in hospitals. There are many times which earlier we never used to see that. There were nurses aplenty, the Safai Karamcharis were there. But now I'm noticing many hospital administrative staff saying that it's extremely difficult to find quality nurses. They go to the Gulf, they go to European countries, and especially so after COVID, that hospitals are feeling the crunch about nursing staff.
It's a serious problem. The serious problem is because in US and Europe, for every doctor, there are 4 to 5 nurses. In India, for every doctor, there is 1.7 nurses, not even 2. Already. Now, across the worldwide, there is a shortage of over 80 million health workers. In England, this year, I think this year or middle of next year, over 2 lakh nurses are going to retire. And they may not be producing more than 10, 20,000 nurses. Where are they going to find the nurses? They are going to take it from India. So in India, when we plan the healthcare workforce, we can't look at what is the India's requirement. We have to look at the global requirement. A English nurse or a doctor will never go to US. A US nurse or a doctor will never go to England. But Indian nurses are happy to go anywhere in the world. Indian doctors are happy to go to any part of the world. We are very comfortable and we have a brand as healers. In US, patients who are treated by Indian doctors, expat doctors, mainly Indians, live longer than the Americans who are treated by American doctors.
Amazing.
Yeah.
There's a study like that?
There's a study conducted by Harvard Medical School or Harvard Business School.
Why? Because instinctively you have more clinical experience, Indian doctors.
What is the passion. See, our culture is caring. Our culture is caring, and if somebody is in pain, our reaction to the person in pain is dramatically different than a lot of the other people. Yeah, we are a very caring group of people. Yes, it is in our blood.
Yeah. So that's quite an amazing thing.
That makes huge difference.
Okay.
See, how will you... Hospital is not the best place to work. I keep saying, I see 60, 80 patients. All of them come with pain, suffering, fear of losing someone, and you have to constantly keep a smiling face and talk to them. You need to be made of a different material to put up with this a whole lifetime.
If I am to come back to the question that I asked you, the shortage of nurses, how can India, how can nursing schools increase? What can be done?
See, this is the country which is blessed by God. If tomorrow Ministry of Health decides that instead of producing 2.5 lakh nurses, we should double the number of nursing seats. And we want to do it within, say, 1 year. We are the only country in the world we can do it, where it can be done. All they have to do is, they should just say that any hospital with over 100 beds can start a nursing college.
It's not happening now?
No. It is impossible to get a license to start a nursing school in city of Bangalore. It is not possible. In no metros you can start a nursing college.
Why?
Because I do not want to give you the exact reason, but there are a lot of hurdles in getting the license. And you can start a nursing school in places where there is no hospital, outside the metros.
They want to incentivize
I don't want to... Existing nursing colleges may not like new nursing colleges to come up.
Oh.
Anyway, see why we should have hospitals becoming nursing colleges. Today, large number of nursing colleges are not affiliated to a hospital. They are not owned by the hospital.
Okay.
Now, when I have a 100-bed, 200-bed hospital, I want to become a nursing college, then I'll be very happy even with the low fees or no fees, because I will have these boys and girls working in my hospital for 4 years at no cost, at no salary, right? And after 1 year of nursing training, they're as good as trained nurses. Whereas a standalone nursing school, which comes up in a shopping mall all over the city, those students do not get exposed to the hospital. So after 3 years or 4 years, they have the license to be a nurse, but they don't have practical experience. Whereas a hospital-based nursing school, the nurses when they graduate, they will be very, very skilled.
But like, for example, I'm asking you very basic questions, Doc, but why, for example, why is your hospital not tied up with, say, a nursing college in Ranchi, that whoever graduates from there, you come to mine? That would be the logical thing?
See, unfortunately, I'll give you one example. At the age of 18, some boys and girls decide to become pilots. And they join pilot training institution. At the end of 10 months, they're allowed to fly a plane with the passenger in it. 10 months. At the age of 18, some boys and girls join a nursing college. And at the end of 4 years, they come up with BSc degree, but good number of them may not even know how to check the blood pressure.
Why? It's so
because they are not trained inside a hospital, whereas a pilot training happens in a cockpit. They don't spend a lot of time in sitting in a classroom and talking about how the plane flies. So our basic problem of our education in medicine, in nursing, is that they're all taught in a classroom or in a library. If you want to swim, you can't sit in a library and learn how to swim. You have to get into water. You spend, more than a year reading about swimming and get into water, you will drown.
So when, for example, when I was just telling you about in some hospitals where they say that, we train the nurses how to deal with these kind of situations. They are excellent. As soon as they become perfect, within 2 years or 3 years, they get jobs in the Middle East, they get jobs, and then they leave. Now, how do we have new crop of, instead of complaining about the situation, of course, everybody has a right to go abroad and do better and then transmit money back home, do well in life. Many of those who get into this paramedical profession also come from lower middle class families. So it's amazing that they are improving their quality of life. But how do we get more graduates to get into the nursing profession?
You see, we need to double we have about 2,500 nursing colleges. We need to double the number of, double or triple the nursing number. Because all of us want poor people to become rich. The only way poor people will become rich is by education, especially nursing education. I'll give you one example. We run a hospital in Cayman Island, which is very close to US, near Miami. We have over 100 nurses who are working there in our hospital, and almost all of them are sending home every month at least 1 lakh rupees. And they are only 23, 25-year-olds. Tell me which girl from a poor family from rural Tamil Nadu or Karnataka at the age of 23, 24 can send home 1 lakh rupees. There is only one profession, that is nursing education, Then it is logical that all the policymakers should start thinking about how do we produce more nurses, because there is a global shortage of nurses and India alone is short of 2 million nurses.
2 million?
Million nurses, yes. See, I told you the ratio of doctor to nurses in India is very sad. For every doctor there is 1.7 nurses. In US and Europe, every doctor there are 4 to 5 nurses.
Yeah.
So not only in India, all over the world there is shortage of nurses. I told you that 2 lakh nurses are retiring. 1.5 to 2 lakh nurses will be retiring in England within the few months. All of them will be taking nurses. I am very happy for our nurses to go abroad and earn more money. But we need more of them to be produced, and that is not what is happening. Because of very, very stifling regulations which prevents starting the nursing college.
Let me get to the doctors. There's a shortage of doctors too. You saying that there are more medical seats which are coming. But when putting your kid through a medical college is such an expensive affair. It costs crores, and that really means taking student loans. Families take loans. India still doesn't have the student loan concept like America has. Even there, 20, 30 years, children are paying loans. In India too, it's becoming expensive. And how does one get over this? Where, like when you said about insurance for healthcare, can there be more? Can there be more people-friendly measures to put your children through medical school?
See, the biggest problem we have is our regulation about medical education. With the current regulation, if you are going to start a medical college, it will cost you over 600, 700 crore rupees. Right? Whereas, I can buy a medical college in Caribbean, which is training doctors to go to US for about $2 million, about 14 crore rupees. I can buy a medical college, which is training doctors to go to US. But in India, to train a doctor, we should get him admitted to a medical college, which costs 600, 700 crore rupees. Right? So this is the basic problem.
Look at the scale.
Yes.
Unbelievable.
There is no comparison.
Yeah.
Right? Now, Why should a medical college require 20 acres of land?
Is that
Yeah, that is a requirement. And you need to have buildings more than, I think, nearly 10 lakh square foot of building, which is designed for a medical college hospital. This hospital cannot be recognized for training doctors because it's not built according to the medical council requirement. You leave that. We always hear that there is a shortage of teachers to train doctors.
Yes.
Faculty shortage.
Yes.
Like, why can't build more medical college? The faculty shortage. Now, what is the definition of faculty? I'll give you one example. Look at training heart surgeons. When you say heart surgery, 2-3 names come to your mind. If you are in Bombay, you hear about Dr. Panda.
Yeah.
If you are in Delhi, you will hear of Dr. Naresh Trihan. If you are in Bangalore, maybe you hear my name.
Yes.
All three of us cannot teach cardiac surgery to young Indians.
By law?
By law. Because we are not working we haven't graduated from a medical college as teachers, as assistant professor, associate professor and a professor.
Oh my God.
Yeah. Then you say there is a shortage of, so you can create faculty shortage but just by changing the definition.
Randomly, if I was to ask, how many heart surgeries would you have done by now?
We have lost the count, but all of us would have done thousands and thousands, yeah.
Thousands per month, I would say, I think.
So essentially we need to when there is a problem, we need to see, Henry Ford's statement, there is no big problem. There are thousands of small problems. So we have to address all these small problems and the big problem will be addressed.
In fact, the Wall Street Journal has described you as the Henry Ford of heart surgery, right? What was your reaction when you read that?
It was funny, yeah.
Yeah, because you're also, another term which was used for you was bypass wala baba. How did these two terms come to you?
No, I love people. And I can talk to anybody.
I just saw, Doc, you were speaking in Bengali. How?
Yeah, I try to speak in as many languages. If you want to be close to their heart, you have to speak to them in the language, their own mother tongue. So essentially, I like people and I like people interacting with them and talking to them about their problems, and I love to help people. You see, God has been very kind to me. Tomorrow God comes in front of me and says, I want to give you anything what you want materially. There is nothing. I have got a wonderful family and God has been very kind to me in many ways. I just want people around me to be as happy as I am. So essentially, I like to help people, and it's not difficult to help poor people.
Yeah.
Yeah, especially in healthcare.
When you were setting up it's almost 2 decades ago, I think, when I first came to your children's wing,
Yeah.
doctor, and there were some Indonesian children
Yes,
who were,
yes,
and you were treating them, and I walked with you and you showed me. I was doing a news story because South Africa had heard about you. At that time, they told me that go to Bangalore, there's a doctor there, and his name is Dr. Devi Shetty, and he's treating children with cardiac issues. And I came here, I don't think you would remember because it was so long back. I saw that at that time, and the care that you take when you deal with children also. One part of your life I want to ask you about was Mother Teresa. I'm seeing a number of her pictures in your room. Tell me about that association.
No, for me, we always look at people with flesh and blood like us. Can't be like God, right? So, but for me, she is something different, even though she was with flesh and blood like us. Yeah. She inspired me a lot in her, and her only teaching I learned from her is the simplicity. Her very, very simplistic approach for life's complex problems. Yeah. Just love, respect, caring for people who are not as privileged as us.
You performed the surgery on her.
I was involved with the treatment when she was I was in BM Birla at that time, and we treated her, yes.
Because when I see you talking to your patients, almost the second or the third thing that you say to them is, don't worry about the money.
Yes.
That is the first.
That is the biggest problem of healthcare. It is not health problem, it is a financial problem.
Yeah. So literally, I mean, the first is that this is the problem. The second is this is the cure. And the third one is don't worry about the money. Right?
Yeah. See, this is the one reason why I am very happy with my life. When I started my career, I had no resources. Today I am blessed with the resources. I can tell anybody that, okay, you have no money, no problem, I'll help you. We'll do something.
Yeah.
There are enough people who come forward and donate money. There are enough ways we can raise money.
Amazing work I saw, during COVID times, which doctors in India were putting, not caring about their personal safety, working. And we're all lucky we have come out of a pandemic situation. And a renewed commitment, I think, to make sure that, we are ready for any such calamity. Are we in any way prepared more than we were 3 years ago?
100%. We are looking at a different world altogether. Next time a COVID situation, we will never panic like the way we did. Yeah. We are a lot more prepared. Hospitals across the country are a lot more prepared to understand the supply chain and everything is in place. We are definitely in a much better position.
We were talking about affordable healthcare. There are many patients who believe that hospitals are not run as a place of service. I'm sorry, I'm being very blunt about it.
Yes.
That it is a business module. What is the solution to this?
You see, as long as people are paying for the care directly, this problem of exploitation, overutilization of services, charging them more, everything will continue. The moment there is a financial intermediary, like a health insurance comes in, everything will change. Because then there is a body which is going to fund the organization, which funds the care, which controls the hospital, and also they have a total knowledge about patient's condition, right? So essentially, right now, person with the problem is directly dealing with the hospital. There is no financial intermediary. When that happens, it will change. A lot of it will change.
I have one question which I have to get to. Cardiovascular disease was seen as a middle-aged men problem. It's not. Even when I was watching, there are 2 women who came in out of 5.
Yes.
So, can you please explain this to me?
See, there are many diseases people are born with, heart disease, right? So they should be treated when they are children. There are many diseases which are prevalent even in 10-year-old, 20-year-old, other than the what they are born with. So these things have to be diagnosed and treated. And it is not true that the coronary artery disease, which leads to heart attack, happens to old people. As I said, today it is the average age of my patients in England was over 60. Here it is 45, 50. Most people who undergo bypass grafting are less than 50. Good number of them.
And women?
Definitely the incidence of women in developing a coronary artery disease is significantly less till they reach the age of 40, 45. The hormone of women prevent them from developing the heart disease. For the nature, women are more important than the men, as long as they are productive life. So the nature protects the women. After 45 years old,
it's at the perimenopause and menopause level. Okay.
Then the incidence gradually starts increasing.
Okay. So when should, back to the same question, when should a person, a man, the primary bread earner, when should he go for a health checkup? When should he take his wife for a health checkup? When should he take his children for a heart-related health checkup?
Before a kid joins the school, they should be seen by a pediatrician for ruling out any serious problem. Then, before, when you complete your school, before joining college, the child's blood pressure should be checked. At that time, they're about 16, 18-year-olds. You'll be surprised, significant number of children, less than 20, have high blood pressure. Significant number. Okay? So their blood pressure should be checked, basic checkup should be done. But when you reach the age of, past the age of 25, 30, every year, you should have a preventive checkup. I'm not saying all the fancy scans and everything should be done every year, but at least once this fancy test has to be done, past the age of 25, 30, and then you should be undergoing routine tests like a blood test or an abdominal ultrasound. You know, these things should be done every year.
Doc, you spoke about diet in the beginning of our conversation. There were some rules which were brought about that school canteens should not have fast food, high salt content in the food and things like that. But if you see college canteens, if you see hospital canteens, you really don't get good quality health food. Even in our office, if we tried to bring in salads, it was rotting by the middle of the day. Everybody goes for samosas. It starts off in the morning itself. If you go to any hotel lobby, you'll see even in a 5-star hotel, people will go for vadas and will go for chole bhature in the first thing in the morning. I can see, the arteries clogging up at 8 a.m. at the breakfast room itself. But how can we change behavioral patterns in our country which tend to affect our heart right from childhood itself?
See, from the childhood, of course, education. But past the age of 25, 30, when you undergo preventive checkup, you will find whatever you have eaten getting presented in your blood test or somewhere.
Yes.
Like if you eat too much of, the fatty food, very large food containing a lot of carbohydrates, you develop changes in your liver. You develop early blockage in the arteries. So essentially the idea of doing the preventive checkup is to hold the mirror in front of you with the numbers. Yeah. When your body weight goes up, when you become obese, the blood pressure goes up.
Yeah.
Many, many things happen.
And then the mental issues that come with it in the sense of facing facts and wanting to change your lifestyle. That's the biggest hurdle, doctor. So you tell me, how do I tell myself and then tell my family that we have a problem? Houston, we have a problem.
Yes.
How do we go about doing that?
You see, the first thing is we have to learn to do simple things. Like sitting is as bad as smoking, right? Because our profession is such today that a lot of the people are sitting all the time.
Yeah.
So I strongly, I can tell the patient, you all have to walk every day. When you say walk, that means they take it for granted. You get up in the morning, then you start walking, right? But walking is not necessary that it should be done in the morning. The best advice I give it to my patient, all of you must wear a smartwatch.
Steps.
And count the number of steps.
What would you suggest for older people to do beyond the age of 60?
See, the yoga is the best gift given by India to the world. I strongly believe that everyone, young and old, must practice yoga. As a young medical student, I was very much into bodybuilding and showing off your muscles. But when I reached the age of 50, I realized that a lot of the aches and jaw pains you come across as we grow older, it's all because of lack of proper exercise to the joints and ligaments. And yoga is something which addresses all these problems. Yes.
So finally, I'd ask you, doctor, you have a high-stress life, lot of pressures, and it takes an emotional toll. I can understand, which you were saying, that in many cases you have patients, you feel humiliated to tell them that you're putting a price on their life. So to deal with these kind of stress, yoga, you said, what is the other thing that you would do to keep your mental equilibrium?
You should love your job. That's the most important thing. I love what I'm doing, so I never get tired and I can work for 24 hours without getting tired. That's one thing. Second thing is, you should be satisfied with what you are doing, and more than anything else, you need to be spiritual. That's very important. Believing, I'm not saying you should be religious, but you should be spiritual. You should believe in the presence of God, because that's very important, because we deal with life. There are patients who have no choice, who have no chance of surviving after the heart operation. But that's the only option they have. We do the operation. They go out of the hospital in 5 days. There are patients who have absolutely no question of them landing in trouble. They land in trouble after the operation. Now, who has to decide who is going to survive, who is not going to survive? So, when people touch my feet and say, God, I feel like laughing at myself. We are all instruments in the hands of God, right? Essentially, that attitude really brings a lot of composure and keeps your mind at ease in difficult situations.
There'll be many who might think that men of science and talking about God, could there be a dissonance in that?
I mean, essentially, a feeling that somebody else is on top who controls what is happening, we don't feel helpless. Yeah, there is a hope that something right will happen.
And family life, doctor, is that important
that
for
is
people?
Extremely, extremely important. Extremely. For me, the best thing what God has given me is a lovely family. Yeah, I have now four children and 6 grandchildren. It's lovely. God has been very, very kind.
It's a pleasure valve, no? To be with the family. And so how difficult is it, I should ask your wife this, how difficult is it for the families of healthcare professionals like you, who are so dedicated to their profession that they spend 12, 14, 18 hours at work? How important is it for them to understand that your work is worship?
See, it's very tough, because when I was having young children, as I said, I have 4 children. My wife brought them up virtually like a single parent. I was never there. I used to go home very late and start very early. I hardly could see children because they go to school. When I came home, they are all fast asleep. It was very hard. Like, I'll give you one example. During COVID, my wife went through hell because her entire family, her husband, her children, all of them were working in the hospital as doctors. And there was no guarantee that which one of us will get knocked out or how many of them will survive. Yeah, it is very, very, very stressful. Yeah. And it's not that, we have some special treatment which patients don't have. Yeah. We are, morning till evening, we are with the COVID patients. So it was very tough for her, and it was tough for everyone. Yeah.
And your children, when they were growing up, they understood that you were at hospital most of the time.
It's very, very interesting. I thought none of them will become doctors because looking at but 2 of them became doctors, knowing fully well what this is. So I thought maybe something. There
are many of my cousins who are doctors, and they don't encourage their children to take up the medical profession because they say that it requires a superhuman to be in this profession, because they say that it requires it's more than a job. It's more than just going to work and coming back. You really have no private life, because a patient can call, unlike in the West, a patient can call you anytime. What did you tell your children when they got into the profession, and what would you tell young children who are apprehensive of joining the medical profession?
I'll give you an example now that you talked to me about my family, about my children. My wife, throughout my early half of the professional life, when I was hardly there, she used to curse my profession. She used to curse every day in front of all the children. Then when my son was in 10th standard, 9th standard, 10th standard, that's the time they should decide what they want to become. Yeah. So we are having dinner one day, and the question of, what you want to do, my oldest son, Viren, and I asked him, what do you want to do, Viren, when you grow up? He said, I want to become an engineer. I said, that's good. You will become a very good engineer. My wife became pale and she started staring at me and staring at him, and I said, what happened? She said, aren't you telling him anything? I said, what do you want me to tell him? Aren't you asking him to become a doctor? I said, no, he decided to become an engineer. Why should I change his mind? No, he has to become a doctor. Why are you not convincing him he should become a doctor? Then I looked at her and I told her that throughout his childhood you cursed his profession. Now you want him to become a doctor. She said, it is the most glorious and the best profession in the world, he should take up. Then I said, that means you didn't mean what you said all these years. But anyway, he became an engineer, but he's managing the hospital. He's a very good hospital administrator.
Okay.
So this is what, a lot of the time, women, what they say, not necessarily they mean it.
But would you encourage young children to take up?
I always ask the children to become doctors. Yeah, I encourage people, young people, to become doctors because this is the best profession in the world. You have everything going. I look at myself as an artist, and this is the best profession. The surgeon is the best artist, right? And it's very creative. And you tend to interact with no profession. Like today, for me, I interact with at least 70, 100 families every day, right?
Yeah.
So my outlook about the society, what society's problem, is dramatically different than most of the others. Yeah.
I remember this, though I'm ending the conversation on a very strange note. I remember when we had the fly past for doctors and medical professionals during COVID. And at that time, I remember, friends and cousins who live abroad saying that, why is this happening in India? Why do you need a fly past for your doctors? Why are they doing all this? And I said, you have to live in India to understand this. Where in India we see doctors as God's creations in this, for us. Bhagwan ke roop mein, like they say. So it is that, because we are leaving our children in your care, we are leaving our parents in your care, and it is for that. So no amount of gratitude is enough for the work that doctors do. So I said, it's not the Western concept of medical care. The Asian concept is completely different. Completely different. On that note, thank you so much, Doctor, for spending your time. I don't want to keep you from your patients. I'm very glad that you gave us this time. Thank you so much, Doctor. Thank you for watching or listening into this episode. Do share with those who you think will benefit from listening or watching these conversations. Namaste, Jai Hind. Click here to watch the previous episodes.